most students in their health professions training don't learn about other resources outside of the clinical environment. And so they really need to actually be curious and to try to dive deeper into what is out there. Sometimes they can ask the providers in a clinical setting. So there may be a nurse, for example, or a social worker who might be affiliated with that clinical unit, and they would be able to provide a lot of information about other resources. But often students need to actually ask patients, because patients are the ones who are out there in the community and may have heard about one thing or another. One thing I as a good example is that patients of mine will often come to see me in family medicine and say, well, you know, there's this program that I've read about in the newspaper, or I heard about advertised in our community about improving my exercise health. And so they might go to a local rec center and learn about a program to make improvements there. They might also use things like food stamps or social networking groups that if there's a patient with a certain illness like multiple sclerosis, they might have some other groups like that. And students may not know what's available locally, but going to the patient and actually asking them about them sometimes can bring out resources that they wouldn't have known about otherwise. So if students don't know what those resources actually are, sometimes they can go exploring. And simple places like a local library or a recreation center might be able to have listings on bulletin boards, pamphlets that are available. Honestly, resource librarians can be remarkably helpful for resources in the community, and they can find out things by taking visits to other places beyond the clinical setting. Sometimes patients are involved in community groups or churches, for example, that might have other services. So, for example, in Denver, there's a community of churches that gets together and provides health services for patients that may not otherwise have them through providers. So, for example, they have health fair screenings, and they might do things like prostate cancer, breast cancer, screenings, diabetes, hypertension, and providers themselves might not know about this because it's not through their organization, it's through another organization like a community group of churches together. There are times that almost public entities is what I would frame it as, have some services for patients, including health fairs. So our TV station, Channel 9 News, for example, has health fairs, and that's where a lot of patients get blood work done. And so patients may not have insurance, and so there may be a barrier to them coming into the provider's office to get blood work done, but they will go to a free health fair and have some of those screening things done. So there are other entities out there that provide services for patients, and they're often more linked or organized within a community rather than through a school or a healthcare structure.